Perfect. All right, guys. I don't know about you, but no problem. No problem.
Sorry. Can you just take a deep breath?
Yeah.
Give a 360 and give me seconds.
That's what I was about to say. I don't take a deep breath. It's been a long morning.
Okay. All right. Stop it.
Perfect. Hi, guys. Hope everyone's doing well today. Today I wanted to talk about healthcare. Healthcare has been one of the primary concerns for all Americans, specifically within the last 10 years. If we look at the total national healthcare expenditure, in 1960, healthcare took 5% of total GDP. So every dollar you take in, about 5 cents of it is going to go to your healthcare. In 2020, that rose to 20%. So everything you're making, on the average American is spending 20% of everything they have to their health, which is wild. It's twice as much, almost 3 times as much as any other European or Western country. And so we find ourselves in a predicament where most people get their insurance through their careers and their jobs, but the people that don't have that option are finding it difficult. So according to the Kaiser Family Foundation, in 2019, about 26 million Americans were uninsured, and many more reports had inadequate coverage, leaving them vulnerable to high medical bills and financial suffering. And this increasing privatization of our insurance, there's this privatization war that's going on where they will increase their costs, the consumer has to pay more, and then at the same time, they're making it so that the healthcare materials are costing more, so the doctors are requiring higher payments. And so it's leading into a cycle that doesn't seem to be quite doing a lot of good for us. Now, according to the United States Census Bureau, 11% of people in Lake County did not have health insurance in 2020, and barriers to healthcare access disproportionately affected low-income and people of color. So what are we going to do about this? Well, in 2016, the city of Montreal implemented a federally recognized healthcare system called CHAS. CHAS stands for Contractors Health and Safety Assessment Scheme. They essentially place these clinics down wherever they see that there is either low insured rates or a lot of preventable deaths. As you can see, they decided to put LATAW here. And CHAS Health is a nonprofit organization that has been providing healthcare services to the community since 2016 and have been around federally for 25 years. They have multiple locations federally, but there's quite a lot in Washington. CHAS Health offers a sliding fee scale. Basically, what you pay is determined based on your income, not on your insurance. And so you could even have insurance or be uninsured, and you will still be applicable to the income scheme. No matter where you are, who you are, what you have, or how much money you have, you are always accepted by them. And now we're by their website. In 2020, CHAS Health served over 110,000 patients. 96% of them said they received the care they needed, and they were satisfied with the services provided. 96% is kind of wild. That's very wild for that many people to be positive, especially in a situation where it's a really high-traffic clinic, and they're getting all the services they need. Not only do they have access to doctors, they have access to dentists. Some clinics have access to vision, and especially their pharmacy. Their pharmacy is also a sliding fee scale. So I'll give an example here. This is actually my doctor. This is Dr. Jolene Amo. I saw her way back in early 2020 before the pandemic. It cost $20 to go see her. Usually it costs about $100 if I went to Gritman. And then I was given a prescription, and the prescription cost $1 for 30 of them. And I looked it up how much that prescription usually costs without insurance, and it was $60. So massive change, much more affordable for me personally and for a lot of people in the area. And so what can you do? Acknowledge there's a solution. If you hear somebody talking about how they need something done, how they're having a pain that they're not taking care of because they worry they can't afford it, well, the reality is they can't. And the reality is that most people think that there's not a solution when in reality they're just not aware of it. and it's hard to get this outspoken. And so if you know somebody who needs this kind of help, don't be afraid to mention it. It's CHAS. You can consider participating yourself if you need a clinic or are looking for a doctor. And donate directly to a community cause that actually helps not only all the college students here, but also the community. So thank you for your time. Appreciate it, guys.